I would like to welcome you all to the November session of the Erie County Workforce Collaborative Training Series. The Erie County Department of Mental Health is so happy to be able to offer these trainings to the dedicated providers in our community. These trainings are being offered to support workforce retention and provide an opportunity for individuals from our provider community to share their expertise. Today, we are so excited to have Christopher Frigon, Senior Therapist from Horizon Health Services, to talk with us about the drama triangle and communicating with people with personality disorders. There won't be a session in December, but we will be resuming the training series in January. All of the sessions are on the fourth Tuesday of the month from noon to 1, and I'd encourage you to all mark your calendars and watch for notices for future events. You can also check the erie.gov/mental health website for announcements, and all of the presentations and recordings for the past offerings this year are posted on our website, and I encourage you to check them out. At the end of the session, we'll be asking you to complete a very brief evaluation. We hope you'll take a moment to fill this out so we can continue to improve. Also, if you would like to hear more from Chris, please include that in your evaluation, and we'd be happy to bring him back. This is a community collaborative, and we are looking for volunteers to share their expertise with our community of providers. If you are interested in doing a 1-hour presentation or interested in a particular topic, please send me an email at amy.rockwood@erie.gov. This training will be recorded. Everyone is muted, so if you have questions, please put them in the chat box. Kathleen Larson from the Erie County Department of Mental Health will be monitoring the chat for us during the session. And thank you again for all joining us today. And I'd like to now introduce Chris Frigon for his presentation on the drama triangle and communicating with people with personality disorders. Thank you so much for being here, Chris, and it's all yours.
Thank you for having me. Much appreciated. This is a topic that I find clinically fascinating, always have. Difficult people are not obviously just people with personality disorders. So what I have found really interesting about the drama triangle is that it applies in a variety of settings, but it is a useful tool for, I call it application, meaning the how to do, the what we learn. So there's many models for what personality disorders are. For orientation purposes, we'll kind of go over that a little bit. Just the background, what is a personality? A lot of definitions of what a personality is, but there are some common threads among those definitions. These identifiable patterns that result from kind of internal processes that are designed to enable coping with life, unique but categorizable. Some of these quirks, traits, they're what make people likable, unlikable. You're looking at me thinking, this guy's jerk, whatever. There's something about what I do that might be a trait that rubs you the wrong way, or you're thinking it's interesting, fascinating. It's idiosyncratic. And because of that, I would suggest that what we're really talking about today is going to be the art of talk therapy, right? Not so much science, yes, science to a degree, as kind of informed by the DSM. What does the DSM tell us that we have to look for a disorder? Well, a pattern of experience and behavior that deviates from cultural norms. And this is super important, the cultural norms part. I could do an hour on that alone. But for our purposes today, just know that we have to establish a cultural norm, a microculture, macroculture, and understand that because we don't understand something doesn't make it a disorder. But we need to look at it, from a broad perspective, whatever the pattern is that we're looking at. And by the way, this isn't just clinical. It's not just talk therapy. Any helping role, I believe, is going to be helped by this model of what we're calling the drama triangle. But what do you need from the DSM to really identify a disorder? Well, you have to deviate from cultural norms in at least 2 areas: the way you think, the way you express emotion, your kind of interpersonal style of interacting with people, and patterns of impulse control. So 2 of those 4, and they have to also meet this criteria described as inflexible, pervasive, and broad. So it can't just be, a pattern with one person or one, situation. It's broad. These folks tend to be on some level disruptive with most people in most situations most of the time, and have for a long time. And very often these are long-standing patterns that began in childhood. Not a requirement, but that often is the case. For our purposes, I'm kind of talking about drama. I think we need a context. So how do you know drama? How do you recognize it? It's obviously going to be through communication, whether that's verbal, nonverbal. People talk, with their hands, their voices, inflection, tone. It is patterns in communication that most of us tune into in what's called a cooperative way. And what does that mean? It means, you say something, I follow that conversation, totally random. Maybe you just come across me in the office and say, hey, Chris, you see the Bills game? Totally random. I said, no, I actually didn't. How was it? How'd they do? I follow you cooperatively because that's what communication generally sounds like. Some people, though, and this isn't always pre-planned. In fact, I would argue through experience, it very often is not. It's really more about the impulsivity of communication. I follow you, then you change the subject on me, but because I'm a cooperative communicator, I follow you again, and then you keep repeating this switch until I get frustrated or aggravated, annoyed, and maybe I start acting out of character with you. This is characteristic of the drama triangle in action. So maybe, you're walking in the hall. Hey, Chris, how are you? Good. How are you? Did you see the Bills game this weekend? No, I didn't. How'd they do? They lost. They suck. The quarterback's a jerk. Oh, geez, I didn't know that. Like, what's going on there? You wouldn't get it. You don't follow football, obviously. And I'm kind of looking around like, what just happened? Like, holy cow, we started talking about the Bills and I got insulted. I don't even understand where it went. And now you're gone, probably engaging in drama with somebody else. Here's what we need to be looking at. And this all comes from, by the way, Dr. Greg Lester, who does a national circuit of training on personality disorders. And this is a good chunk of his intervention section. So I freely admit, like, this is lifted for application purposes. It's such a beautiful model. And we'll talk about other models a little bit. But for Greg Lester, identifying these three roles, it's super important because it gives you a foothold, at least a starting place, to understand what's happening when you're interacting with non-cooperative communicators. And again, very often that is tied to your interaction with people who have been identified as maybe having a personality disorder. They are non-cooperative communicators because they live in these existential roles. And the way Greg Lester defined them, rescuer, victim, persecutor, there's some interesting dynamics that will happen in here. Now, these are existential roles. Now, when we talk about how do we identify ourselves and expect identification from other people, you might meet somebody new and you say, hey, my name's Chris. I'm a social worker at Horizon. What do you do? And they'll say, oh, I'm a teacher over at, Kenmore West. Okay, cool. And then you start talking about maybe being a dad or a mom, your family relationships. Most people identify with social roles. I'm a teacher. I teach kids. Cool. Now, to validate to be a teacher, you have to have students, right? Now, I get this is a bit of a shallow kind of argument a little bit, but if you think about it, a teacher's a teacher when they have students to teach. There's a validation thing there, right? Otherwise, you could say a teacher without students is a person with a teaching certificate. So there's no real world validation of that role unless you have a complementary role. Now, this is where the drama triangle really matters in terms of being able to identify what's happening. If I am living in an existential role, rescuer, victim, persecutor, I need a complementary role to validate where I am. So I will seek out interactions that validate my belief about myself as some hero or some bad guy or someone who's chronically victimized. These are what I call the shoe people. And what do I mean by that? We've all said how maybe we're just waiting for the other shoe to drop. Like we experience a little bit of negativity like that, most of us. But some people live in that world of always waiting for the other shoe to drop. And you will hear them refer to that over and over and over in their conversations with you. And it can feel difficult to get in to have a therapeutic conversation with that person or a change-based conversation when they're so over-focused. on some negative outcome in a future that they can't reasonably predict with any kind of specificity, but they believe. So I would say that they're living in that victim role, waiting for the world to happen to them. So as a side note, when I hear this as a pattern, the person repeating it, I'll simply say some version of, yeah, that shoe is going to drop eventually. Why don't we learn to live between the shoes? Like, that's where life's happening. And when the shoe does fall, like, we'll deal with it. Like, that's life. But for now, let's get between the shoes. This is a way of not engaging in that drama triangle, validating their belief, their emotional, concern or anxiety about what might happen, but then kind of reframing into another way of thinking about how to be in this moment. What I'm not going to do is rescue the person and say, oh no, what's the shoe? What can I do to help? Can I prevent it? I'm not going to be the persecutor and punish them and say, oh, come on, you're overreacting and, there's no shoes. Like, these are common mistakes that people will make in conversation that immediately engage that drama triangle, right? Because now the victim has validation from me being a bad guy or a rescuer. So that validation will then reinforce their belief in their own victimhood. And what happens if the person doesn't get immediate validation? Well, they can engage in something called a drama switch, which we'll talk about a little bit later. In order to truly understand kind of what these roles look and sound like, right? I think it's helpful to go back to the DSM criteria, right? People have to have this deviation from cultural norms in 2 or 4 areas. So let's look at some of those. Like, what do you hear a rescuer sounding like when they're talking? They will reference needing to help, needing to save people, rescue people, to not let bad things happen, right? To take care of someone, to really get them out of some kind of situation. Often rule bending and rationalizing to be the hero. It's how they tend to think. Like, that is their role in the world. Put the cape on and make sure no one gets hurt. Emotionally, typically lots of sympathy as opposed to empathy. Not that sympathy is a bad thing. By all means, I fully believe sympathy has a very strong social meaning. If I can't truly empathize, I can't offer sympathy. That's totally fine in the right context. But these folks tend to have this like condescending sympathy. And that's where it kind of gets a bad name. And they will often actually even frame what rescuers do. And please, by all means, don't take this too far. But the standard definition of an empath has really been someone who takes on someone else's emotion to a degree that it causes them distress. And yet you hear a lot of rescuers putting this badge on of I'm an empath without fully understanding what that even truly means. It doesn't feel good to have that character quality. It actually feels painful to be so empathetic that you can't differentiate self from other. What they're really truly experiencing probably is sympathy. They feel bad for someone. They get desperate to try and help. That rising feeling of desperation, a lot of strong desire, emotion, and then guilt and shame when they can't rise to whatever they believe they should be doing to rescue, as they will often frame it, help. And they get embarrassed if their efforts aren't quite getting the rescue thing happening. Behaviorally, above, and beyond, their behavior to help others can be so like over the top that it stands out, and it can make one question oneself. Like, geez, am I that cheap that I don't do what that person does? Like, but they're so over and beyond that it really stands out. Lots of lending, spending, over advocating. What's interesting about the drama switch with the lending thing, they will perceive themselves as extraordinarily generous, but then very resentful when they're not paid back. Right, so the drama switch, rescuer, victim, over focusing on one person at the expense of others and self. Now, how about the persecutor or the bad guy? Cognitively, yeah, okay, there's a bad word in there, but asterisk out. But this is how they think, like a lot of negative language, get them before they get me. There's a saying from the Marines, right? Like, kill them all and let God sort them out. And I get that has a context in that culture. I'm talking about somebody not in that culture, but thinks that way. And watch out for people that kind of, in a patterned way, jokingly maybe say, I hate people. like that deserves a little exploration, like I get we have a moment. I don't know, you're in bad traffic at Niagara Falls Boulevard this time of year, right? Coming right out by that Target, what is a Target and a Best Buy, and I forget what else is all around there, Moe's maybe. But there's like 8 lights in 2 blocks. It's really easy to get into that mode of I hate people, I just want to get home. Okay, fine. You don't really hate people, you're venting, having a moment. These folks, no. All situations. Thanksgiving, I hate people. That's your family, right? Yeah, no, I hate people. Oh boy, okay. What about Christmas? Oh man, Christmas, those people are crazy. Black Friday, somebody should just take them all out. Whoa, all over the place, these people think this way about other people. Emotional, their emotional sides, lots of anger, hatred, frustration, fear, uh, wanting to be dominant, so having these feelings of dominance, and yet vacillating between being powerful and powerless. They don't like the idea that many of us can arrive at through something very simple, like say the Serenity Prayer from AA. Know what you control and what you don't. These folks don't believe in that. Like powerlessness is an untenable place for them. Most of us don't like that place, but they will fight and resist it and try and take control over whatever they can as a means of feeling some sort of agency in the world, even things they legitimately have no realistic way of controlling. And it can get really, really abstract. And I'm not going to get into it, but you can watch a little bit of TV, current events, and see it happening. Maybe it's some bridge in Dallas. It's weird. Anyway, behaviorally, how do these folks act? They're late, like as a means of punishing. In other words, they kind of control you by being late. Like they think they're making you like somehow wait for them. So I don't know. It's what they do. They're withholding in conversation. These persecutor folks, they're the ones you will ask open-ended questions and get closed answers. We often frame that as, oh, this guy got to pull teeth to get anything out of him. Yeah, they've got the information. They're withholding it as a means of punishing. They can be very intimidating, meaning outwardly aggressive toward folks. They get too loud, they're too close. Very specific blaming as compared to what we'll see later with victims who do kind of like vague blaming. These folks pick people, groups of people, and blame. They believe in fault. Like fault to them is actually an issue, and it's not related to their employment as a judge or an insurance adjuster. Like they live in a world of whose fault is this, and it's not theirs. Meaning they're externalized. Other people cause their problems. This is the person who gets pulled over doing 85 on the 90 up by UB, because maybe that's happened to me a couple of times. And in the context of that event occurring, they blame the cop, right? It's got it out for me, or got it in for me. I was just going with traffic. We've all had that. We've said that before. And we all kind of know it's a bit of a ridiculous out going with traffic. But no, these folks believe that, and that the cop somehow is just a jerk, who's got it in for this person. They don't account for their own role in problems, very demanding, don't return phone calls, again, often as a means of punishing or minimizing other people. The victim, this is probably the most common drama role, at least that I see, clinically and frankly, personally. People who kind of live in this victimization world. And it isn't about truly going through victim experiences. So we've all been victimized. We've all had that awful feeling of shame. And that shame feeling is a vehicle to move through victimhood to surviving and eventually into thriving. It's an emotion designed to help us kind of move. These folks stay stuck and identify with that victimization and the shame of it. They, at their core, somehow arrive at this belief that they're no good, they're a bad person, a bad role, parent, client, whatever. They don't deserve things. You'll often hear stories about how bad they are or how they don't deserve things. Externalized meaning they also don't own their role in things. They believe that things shouldn't be happening to them, right? A lot of persecutors often will say things like what should be happening. They know what's right, and they also know what's wrong and are happy to tell you. Victims kind of have this pattern of believing in what shouldn't be happening. This kind of passive, the world is happening to them thing that they have no way of kind of interacting with. So they're asking for help to be fixed, but then they want to be left alone. They personalize, and we talked about shoot people. People kind of chronically think about the negativity of a future, kind of living in that victim role. Emotionally, this vacillation between angry and scared, sadness, a lot of powerlessness, a lot of shame, self-loathing, disgust, angst. They tell stories about feeling this way. Their depression and anxiety is characterized by these kinds of feelings. And remember, these are all broad. This isn't about a one-time event someone survives. This is about a lifetime of being in a victim role. Behaviorally, they're avoiders, a lot of complaining. And by the way, I like to distinguish complaining and whining because I like complaints. A complaint, kind of by definition, almost like incorporates a potential solution within the complaint. Like, I don't know, I show up at the store, I bought a product and it's defective, and I walk up to the clerk and, hey, like this thing's broken. Can I get a replacement or can I get my money back? I'm offering a solution within my complaint. Whining, though, whining is just walking up to the counter and going, this is broken. And then just like waiting for the world to do something about it. And this is what people who live in that victim role tend to do. They drop a problem, but then offer no like potential role that they could assume to help resolve the problem. These are highly driven advice seekers. What would you do, Chris? If you were in my shoes, what would you do? Often it's directive. Tell me what I'm supposed to do here. Which most of us know advice tends to be kind of a rabbit hole that we don't want to go down. Very vague blaming, and it's not my fault. Not that it's your fault. Whatever's happening is not my fault. Just isn't. They stay quiet, too far away, and often entice a chase. If you do any couples work, you see this a lot in what's called the Four Horsemen of the Apocalypse from a couple of really important authors in the field who talked about what makes relationships not work. Victims entice that chase by stonewalling. They just don't engage with people when there's conflict, right? Because they start to feel victimized by the intensity of the situation. So they kind of shut down, go away. And when we're working with folks like this, we often have to draw them in, find some hook to bring them into the conversations we want to be able to have with them. So if that's a kind of a brief overview of what the three roles kind of look like, sound like, feel like in terms of how they think, feel, and behave. What about us? What do we have to do? We need a role of our own to identify with to not get into that triangle. And that role is what we're going to call the scientific observer. And how do you get into that role? Well, you observe. Just observe. Breathe. Make sure you're keeping yourself nice and balanced. We certainly don't want to engage our own countertransference and then project it out, but be aware of that countertransference. And for folks that aren't aware of maybe the term, it's kind of just when you're having an intense emotional reaction about somebody that it seems a little out of character maybe, or it's not going to be helpful to a situation. But you need that emotional information about yourself to know the drama role that might be happening, or that you're being engaged in terms of a complementary role to validate the role the other person starts in. So definitely take time out. A lot of cooperative communication is kind of back and forth. It's like tennis, just hitting the ball back and forth. And it feels like a logical, not illogical, but it feels like a natural flow. With folks in drama, though, our model is not going to be tennis. Our model is going to be playing catch. You're going to catch the ball with your mitt, and you're going to hold that ball for a second and decide what you're going to throw back. It's a game of catch rather than tennis. It just gives you a moment to kind of sort through response options to avoid getting into someone's drama. The idea is to respond and not be reactive. Whereas in cooperative communication, we can be reactive because generally speaking, even if we say something weird and don't intend it, a cooperative communicator with us will get it. They'll filter it. You didn't mean to say that, or, they'll ask about it like, oh, I'm confused about what you just said there. But non-cooperative communicators take that reactivity and create an alternate pathway for the conversation to go down. And if we have a moment, I might demonstrate that in a couple minutes. At the end of the day, remember to take care of yourself and other. Therapeutically, it's not personal, but as I mentioned earlier in the talk, sometimes this is, by the way, this will come into your personal life. Um, it's a little bit of Pandora's box, I suppose, right? Like once you see this stuff, you kind of can't unsee it. You will see these patterns. Don't get into this thing where you're diagnosing, your dad or something. But understand that many people from time to time, to whatever level of distress they're in their life, will land in one of those drama roles. We all do it. If you're a social worker, like you're attracted to the field of helping for a reason. Many of us are predisposed to kind of accidentally get into that rescuer role. I don't know if you've ever been at a case conference, maybe just talking about a case and there's recommendations coming. I've done this myself, where I'm talking about a case and I start over advocating for the person that I'm working with, and I'll say to colleagues, you don't understand, like, that's not going to be helpful for this person, or, I'm not being clear enough. This is what we really need to do. We really need to get this person, blah, blah, blah. I start over advocating to the point where there's like an awkwardness in the room, that's a rescuer in action. I've done it, of course. And we've all had these moments of being in any one of those drama roles. So what matters is the pattern, broad, pervasive, inflexible. Even when offered options for ways of handling things differently, the person resists and wants to go back to their drama roles. Remember, that is their identity. They're not teachers, moms, dads. They're rescuers, victims, persecutors. They need validation of that role through you taking on a complementary role. This, by the way, is why we start to feel crazy, because we keep getting jostled around in these odd conversations, and then very often left with this emotional thing that we didn't start with, but now have, and don't really know how we got it or what to do with it. This is what we say, it's not personal. These are professional conversations, and this is the art of talk therapy, or truly any kind of help talk that we're going to offer for people. Professional, and yet art. And what does that mean? It means you have to know what kind of paintbrush you have. What is your therapeutic style with folks? Uh, and really use that to your advantage. I tend to kind of fall into like I suppose a Linehan way of thinking around dialectical behavioral thinking. I like dialectics a lot. I like the idea of irreverence. I also, by the way, like Bill Burr, and I like Mitch Hedberg. Like I take influence from a variety of places. Bill and Mitch stand-up comics. One great line that I love thinking about in working with folks. Remember to not personalize it. It comes from a bit from Mitch Hedberg, and he's talking about you can't please all the people all the time. And last night, all those people were at my show. Like, we just can't personalize that sometimes our stuff doesn't land. It's okay. And this is why we respond and not get reactive. So you're offering something to a client that you're working with, they reject it out of hand. It's okay. Don't defend it. Find a way to roll around it. Motivational interviewing, of course, helps with that, the rolling with resistance idea. And it's not in my head that people are resistant or non-compliant. It's that they're living in drama roles. And right now, that's the best they know how to do. So we need to help them find ways to not live in those roles. We can show them that. You can use appropriate kinds of metaphorical disclosure, third person or role playing to help people move out of roles. Once I have an established relationship with someone, people get used to this versus this. So I don't know how clear that was on the screen. Okay. So right hand, when I hear like a statement that's coming from that victim place, eventually in therapy, I just kind of throw up the V and I'll look, and that's like the nonverbal cue, like, can we find a different way to say that, right? You're coming from that old place again. And when I hear more survivor talk or thriver talk, it's left hand and it V, and this is voice, right? Like the antidote to victim is voice. And that's part of the change talk we want to help people with specific to the victim role. Back to this idea of drama switches. And again, this comes from Greg Lester, and the abbreviations kind of speak for themselves, but just in case, PPD is paranoid personality, SZ PD, that is schizoid, which is an interesting drama switch. We switch because they're detached. They don't actively necessarily switch. Again, this is Lester's model. SZT is schizotypal. Uh, the ASPD is antisocial, BPD borderline, HPD histrionic, NPD narcissistic, AVPD is avoidant, DPD dependent, and OCPD obsessive compulsive. So when we look at specific diagnoses, Greg Lester looked at patterns that he identified as common switch patterns that personality types tend to engage in. I haven't looked in that much detail about it to really think about it at that level, but I think it's worth putting out there. In other words, once you start watching these drama switch patterns, you can identify a predictable pattern which can help you play catch a little more effectively. So if you know you're starting with someone who's in, say, a victim role, then you can anticipate with the dependent personality, they're going to move from victim to bad guy, right? That's what they will do to engage you into a complementary role. What does that sound like? Chris, I really need your help. Please, you give me the best advice. You're the best therapist I ever had. Like no other therapist has done it. They're just terrible, and I've always suffered for that. Okay, I'm not really an advice therapist, so let's walk this through. What are your ideas? Okay, so fine, you suck just like the rest of them. Oh, geez, I'm sorry. It's all about getting me into that rescuer role, right? It's what they want. So they will switch their talk uh, from one role to another as a means of eliciting me to rescue them. Your goal again, scientific observer. Stay out of that drama. Observe, describe. And when we talk about approaching people, this is the art of talk therapy. How do we talk to people? I'm not a fan of nice. It's got its place. My model is about kindness, which is active and responsive. Nice is kind of passive and avoidant, right? And a good example of that, I'm a nice guy. So, maybe I'm walking down the hallway at work and I see a colleague, and they got a little hangy sitting there, and I'm just a nice guy. I don't want to embarrass them. So I'm just not going to say anything. I don't want them to feel bad because I'm nice. Well, the problem is niceness passed along the responsibility to the next person in the hallway to now have the dilemma of what do I say to that person, right? So a kind person will find a way to engage a person about what I call the booger in the nose. Like we all have them from time to time. A kind person needs to engage people around conversations about their drama roles, kindly, therapeutically, as a means of helping them. The idea being, if they're doing it with you and they're telling stories about where they're doing it out in the world, it's causing problems. So we need to find a way to have a conversation with these folks. How do we do that? Kindly, defining these roles non-pejoratively, finding ways to communicate about what the nature of personality patterns are. I very recently had to have a conversation with somebody who had appropriately wanted a records disclosure request. Like they wanted to see their records. And in their records was schizoid personality. Now, I don't know about you, but even though I know a bit about the field, if I'm reading about me and I see that word, I'm going to struggle. I mean, that's an ugly word. And colloquially, out in the world, it means things that we don't mean by that word at all. So we had a really good conversation, this person and I, about what that word meant. And at the end of it, it was very interesting because I'm on the phone and I'm thinking, this is probably a pretty accurate diagnosis. It just sounded like, wow, okay. But how do you language that kind of thing to a person so they can tolerate without getting into a drama role? It's education. It's acknowledging the fact that, this is an old and kind of ugly word, which doesn't mean what the movies say it means. So here's what it actually means, describing a pattern of behavior and interactional styles. And hey, only you can tell me if this actually makes sense for you or not. I'm not going to assign that to you, right? Would you say that is something that maybe is characteristic of how you interact? And they were acknowledging, I actually really do prefer like not being around people. I don't get stimulated by people much. In fact, I tend to want to avoid. Okay, cool. It was a very interesting conversation, which at the end kind of resulted in the person saying, maybe I really should call my counselor back and start up again, because they'd stopped and wanted us to the records. So, hey, like, ask for whatever you want to do. So the language of our professional world, understand, can be painful when people don't understand what it means, which brings me to a couple of points I want to make about BPD and the illogic that many times folks in the world are kind of stuck with. So let's say I go through a bad life event, and for whatever reason, I'm just not dealing well with it, and I decide, you know what, the end isn't nigh, it's now. I'm done. I'm going to check out. And I try, and I wind up at the hospital because I attempted suicide. And the doctor's talking to me, and I arrive at my first clinic appointment maybe a few days later, and I'm carrying now a borderline personality diagnosis. Why? Because I attempted suicide. It's like this weird heuristic that happens a lot. And yes, I'm oversimplifying, but clinicians in the world out there, you've seen it. And it can be a frustration because it frankly just might not be accurate. And it certainly isn't likely going to meet the criteria the DSM requires, right? Which is broad, inflexible, pervasive. I don't know how much time these evaluators may have had to establish those kind of patterns, but in the outpatient world, it will take weeks and months, and sometimes longer, to really decide. This is a legitimate, long-standing pattern that meets the criteria for a diagnosis. That aside, if we look at DSM criteria, it also has, which people argue, and I would tend to agree, are arbitrary cutoffs, right? So you need to have 5 of 7, 7 of 9 criteria met, which means, borderline is not borderline, is not borderline. There's flavors or different types. Milan, in his book, Personality Disorders, DSM-4 and Beyond, which is, to my reading style, it's an amazing book. It's just so detailed about history and intervention and styles. But what he really breaks out are subtypes of all of the 10 DSM personality disorders, plus a few other disorders that he looks at from, I suppose, an educational perspective. But they're very interesting to read about, highly informative in terms of differentiating maybe the person that you're with. So we don't do cookie cutter borderline is borderline, because it just isn't true. And what does that have to do with the drama triangle? Not everybody that is difficult is going to meet full criteria for a diagnosis, but they certainly have these features, one or two, that just over and over and over recur with different people, different places over time. They just do, but they don't meet full criteria for anything. So what does that mean? Does it mean we just ignore? No. To my way of thinking, again, clinically, these are really important targets because personality, to some degree, is theorized to drive many other presenting issues, whether it's affective disorders, substance use disorders. It's personality preferences that tend to drive those issues. So if we can look at targeting this drama triangle and how people are engaging it in the world, even just through a couple of features that they might have, then it's really important work for us to do. And what do I mean? Let's say I, as a client of yours, I'm sitting in the office and I clearly have what the DSM describes as a real or imagined fear of abandonment. It is real, but I also imagine it. Let's say I do both. So you're looking at me and going, yeah, this dude's borderline. But wait, he's only got one criteria out of X. Like, what does that mean? It means I still have that fear. I still have that abandonment issue, and it needs work. And when I'm talking about abandonment, I will likely go into drama. I'll be talking about victim stuff. I'll be exploring the idea of who the bad people were that hurt me and left me. And I may be depressed about it or, avoidant of relationships a little bit, but maybe I don't really have this like disorder that would require some kind of specialized, maybe DBT track of treatment. But I certainly want my therapist to work with me on the abandonment. Knowing the drama triangle and identifying the role that I'm in helps you to avoid getting caught in the trap yourself, to stay out of that triangle. So it's a very effective tool. And non-clinically, just a little, side story. I was talking to an office manager many years ago, who was telling me about having to do some kind of progressive discipline with what she called a difficult employee. And I said, well, just as an idea, like, see if this helps. Get a sticky pad and just draw this triangle. And we drew it, and put the rescuer, victim, prosecutor, and just kind of stick that on your monitor where you can see it, but the employee who's across from you doesn't see it, right? Doesn't know that it's there. It's kind of like just a little visual reminder for you. Now remember, this is an office manager, not clinically trained, and this is the power of Lester's triangle. It's simple, it's easy to remember. So she did that, had it right up there on the monitor, and she said it very much helped ground her to avoid going down the rabbit holes this employee was doing when the moment actually happened. And here's a couple of ideas about what those rabbit holes look and sound like. If anybody gets a moment to kind of just either YouTube or just read about logical fallacies, it's really informative in helping you identify how people engage these drama roles. So in this particular conversation, the employee was kind of being disciplined around attendance, time and attendance, and she was doing all kinds of whataboutism. And it's a logical fallacy that avoids the conversation that needs to be had. So if I'm the office manager saying, look, we need to come up with a plan for time and attendance for you, to help you, kind of become the employee that we all know you can be and we hope you to be. The employee then redirected to, well, what about so-and-so? Like, they were late on Saturday. I don't see you talking to them. This is the engagement into drama. When people do logical fallacies, people will use straw man arguments. They'll replace the argument that you're actually having with something else that feels similar, but it's not, right? So maybe we're going to have a conversation about the legalization of marijuana. And someone will say, what do you think about the legalization of marijuana? Is that a good idea, a bad idea? And the person might then respond with, societies that legalize intoxicants are going to go down the drain. It sounds related, but I didn't start with intoxicants. I just started with marijuana. So they're replacing the core subject with something else as a means of not having the conversation that I initiated. They're beginning non-cooperation. And if I follow that path down to all intoxicants, I'm going to get lost. The original conversation will never be had. Our job in catching the ball and throwing it back, and staying out of drama, validate first. I'm a full believer in that. I love Linehan for that. Validate, hold out the expectation for change. The chief dialectic from DBT. Bob, I hear you. You want to have a conversation about all intoxicants? Let's do that. I kind of want to finish the first conversation, though, which was really just about marijuana. Can we start there first, right? You keep bringing back, drawing back, drawing back. In the conversation with the office manager and the employee, obviously I can't talk about other folks, but if you have concern about what you see as a pattern, I'd like to get to that. But let's go back to what you and I are going to do together to work on time management and right, coming back. Don't follow down those rabbit holes. And you're kind about it. You're kind. I hear you have a concern about X. However, let's go back to where we started. It's being kind. It's not ignoring. It's not invalidating. But it also isn't validating. It's just not invalidating the person. Another kind of classic example. Well, there's a lot of logical fallacy examples we could go through. I would, again, strongly suggest, just for familiarity purposes, kind of look up what they are as categories, and you'll start to see them. Some of us do it non-consciously and unintentionally and can recognize our own error from time to time and then self-correct. But people who live in drama, that's not so much the case. They're not invested in self-correcting. They're invested in drama. And all three roles, by the way, interesting observational, have a very strong need to be right. Now, I would grant that being right seems to be something of a survival need. However far back into our history you want to go with that, whatever. But people do kind of have this intrinsic interest in right. Your goal in working with folks is not to be right. the emotional goal, when you start getting into like scientific observer and trying to find the conversation to have to move people to that change talk place, it's curiosity. A scientist doesn't need to be right. In fact, the scientific method isn't even really about right, it's about curious, gathering more and more information to arrive at better and better, maybe experiments or more concise hypotheses about how things might work. That's kind of the role we want to find ourselves in. Stay as curious as you can all the time, wondering about what this dynamic is. Am I even reading it right? Right? Is this a broad pattern or is it just me? How do you know? How could you find out? What is a kind way of asking? Do I rub you the wrong way? Because I'm observing something here and maybe it's just me, like this therapeutic relationship we have. As a mentor of mine said a long, long time ago, Chris, there's two of you in the room. Like, it isn't just them. But by the way, it isn't just you either. So being respectful of the nature of relationship, particularly with these folks, it's about finding kind ways of interacting around that drama triangle. So I probably hammered that hard enough. I thought maybe it might be interesting to do a little maybe demonstration of what non-cooperative communication looks like. It's totally harmless. I guarantee it's actually just a very simple joke. And if I remember correctly, Kathleen, did you volunteer to maybe help me out with that?
Sure.
Okay. So it's just a simple joke. I got to click my volume up a little bit. There we go. Okay. You okay with jokes?
Yeah.
Totally clean. In fact, it's totally a kid joke. So whatever. So knock knock jokes. You know how knock knock jokes work?
Yes.
All right, cool. You ready?
Yep.
All right. Knock knock.
Who's there?
Knock knock.
Who's there?
Did I screw that up? Hang on. Let me start over. Sorry. Do that all the time. We'll start over. Knock knock.
Who's there?
Knock knock.
Who's there?
Man, I don't know if it's me or you. Hang on. Okay. Totally different joke. You ready? Okay. Knock knock.
Who's there?
Banana.
Banana who?
Right. Okay, you get it. So let's go back to the first one. Knock knock.
Who's there?
Knock knock.
Knock knock who?
Yeah, bingo. Thank you for volunteering for that. So for context, my 8-year-old daughter got me on that so many times in the car, I wanted to punch the window. Like, it was driving me crazy. Love you, Tori. Thank you. This is an example through humor of non-cooperative communication. I simply start this very innocuous conversation. I do something that seems like a pattern You think I'm restarting the joke, but I never really was. And then, when I'm not doing with someone I don't know, if it's a person I do know, I'll do persecutor role pretty intensely. Like, what are you, stupid? It's a knock-knock joke. How could you not get that? I will amplify what persecutors really do, or I'll amplify the victim. I'm the worst joke teller in the world. I don't know what's wrong with me. Like, it's a means of demonstrating how non-cooperative communication engages the person into their role, self-validates, and then they seek out other people to get into a complementary role to validate. So you might well have said, Kathleen, oh, Chris, you're not a terrible joke teller. It's my fault. I wasn't understanding. Or if I insult you about you don't get a knock-knock joke, what's wrong with you? You're likely to get into victim role. You're the one that started the thing over. Like, you're the one telling bad jokes. Yeah. Obviously, this is a very kind of personal version of how drama might work in non-cooperative communication. But there are so many corollaries in our therapeutic work with people, any helping work, where we think we're following a pattern because most of us are predisposed to simply cooperate in communication. Kathleen saw me start the joke over. If you saw her nonverbal, I mean, her face even showed a little bit like, is this dude starting over? But she went with it. She's cooperating with my non-cooperation, what she did. And this is what we all tend to do. We fall for it. Don't get hung up in that. My bit about manipulation, by the way, we get manipulated all the time. So I don't know why therapists take such a hard line with it. It's about recognizing it, helping someone understand as a colleague of mine said years ago, it's about learning to use your powers for good. Like if you're good at presenting information to people in a way that gets them to do something they wouldn't ordinarily choose to do otherwise, you know what that makes you? That makes you a therapist. Like that's what we do for a living, frankly. You know, like we reframe things and help people find reframes. We're encouraging people through our experience, education, knowledge, belief in our theory, uh, in doing something they wouldn't ordinarily choose to do otherwise. Okay, so manipulation is not a bad thing, but sometimes, by definition, there is sometimes nefarious intent, uh, and that, of course, is the persecutor. It is often the rescuer who wants to switch to persecutor or switch to victim. So I will loan you 20 bucks, but then I'm going to go tell all your friends about how you're, poor and you're not trying to get a job. Like people that live in drama will do that. They will use some kind of manipulation, but most often, and this is a really important point from Linehan about it, it's a logical fallacy to believe that because you feel a certain way, that the other person intended for you to feel that, which is why it's really important working with this population, whether they're, carrying full criteria for disorder or not, that we establish kind of the inflexibility of the pattern we're working with, the rigidity, the avoidance of change, and the broadness of it. Because in that way, what we're really establishing is just momentary interaction with people. So it's not a manipulation. For example, and I use this a lot. If I'm walking down that hallway at work and I see someone coming towards me, I kind of don't recognize them. They flash me a nice wave. We're closing in. So I wave back, and then I realize the person isn't looking at me; they're looking behind me. So I look, and there's some other, and they're waving, "Hey, let's go have lunch." I'm embarrassed. I feel stupid. Like, geez, very common social experience, I suppose. Linehan's point is it's a logical fallacy to assume that that person intended for me to feel embarrassed. Like, I misread the situation. And I think we have to recognize that we're all just people. We all can do that too. Misread a situation, which is why it's about curiosity. Staying curious working with people, but then looking at these underlying patterns and figuring, again, if it's happening here, parallel process, it's happening out there. Let's find creative ways to disable these dramas. So I see we've got, we're coming up on maybe 5 till. I don't know if that leaves time for any questions or anything that the audience might want to get to. I don't know, Kathleen, if you were monitoring that.
I don't see any questions that came in yet, but feel free if anyone wants to type anything in, I will send them out.
Even specifically, if I was not clear about something, I want to own that, and I would be more than happy to go back and explain whatever I could to make something more clear.
I don't see anything that came in yet.
I'm guessing people are just digesting this. This was fantastic.
It is a lot of information packed in, I grant. And, for context, I was first trained or went to a training by Greg Lester. It's got to be 20 years ago. I've never stopped thinking about this since, So it's one of those things. I have a native interest in it. Read into that, whatever you like. I like this population a lot. I find it fascinating. I remember being 14 years old, delivering newspapers and like walking away from interaction thinking, why are people so crazy? Like at 14, I sensed something was either wrong with them or me. I didn't know. And it's just kind of been this intrinsic interest ever since. In terms of cooperative and non-cooperative, by the way, let's talk statistics for 1 second. The DSM, if you add up the numbers of all 10 of these diagnoses, just, 2% of this, 3% of that, or 2 to 3, if you add that up, it comes to 16 to 20% of the general population. So for context, that's enough people in the Buffalo area to fill whatever we're calling Rich Stadium these days. like at any given time. That's just our local community, right? Like 16 to 20%. Do the number on a population of 330 million, the US population. Greg Lester's funny in talking about these people don't stand out from the crowd often, they are the crowd. So interesting. We get so used to interacting with non-cooperation that we kind of tend to miss it, you know, and that's okay. The drama triangle really helps us refocus clinically so we don't miss the phenomenon and can be more effective and engaging and not feel so powerless ourselves. Many people frame these 10 diagnoses as, you know, difficult or they don't change, and I've got a bit on change, which I won't get into, but these folks do change. It just takes time, and I would argue a certain kind of style, and my style isn't for everyone. Fully acknowledge that. Not everybody can deal with, you know, my irreverence, my weird little side stories. That's cool. You know, my examples where I like to draw them from. Many other styles will work, of course. But I do believe that Lester's idea that identifying this drama triangle is such an effective tool because it gives the clinician, the worker, a foothold for where to start. I did reference earlier there's other models which would address the nuance of people a little more probably effectively. But then you're talking about maybe 8 different drama roles to have to think about. There's a very good book about that. I wish I could remember the title.
That might have been one of the questions. We do have a couple of questions that came in. One
Sure.
was about the books that you referenced. Someone was asking what books that you referenced.
So Milan's Personality Disorders, DSM-4 and Beyond. That's the biggie. When I say biggie, oh shoot, I got that freaking background now. And anyway, it's like a double columned like tome. This thing is just, to me, the most amazing book on personality. I've read through the cognitive behavioral intervention for personality disorders based on the CBT, you know, back. Okay, there's some interesting information in there. Greg Lester, I probably sound like a shill, but he's got a book called Power with People, which is not about professional interaction so much. It's about personal. So again, taking these tools and recognizing that you can use them effectively personally, but then also, you know, as a professional person reading the book, you can see clear application to therapy in your session work. So I would strongly encourage find that. I don't know how easy it is to find, but it's a good book. I don't know what else I referenced, frankly, Kathleen.
Okay. We do have another question that came in. This one is, what is a non-pejorative way to explain rescuer, victim, persecutor to the client?
Okay. It's a great question. So I have no problem with the word victim, but I frame it, I couch it, just kind of how I did earlier. We've all been victimized, but none of us really want to tolerate like identifying as victim. So I think we have to have some mechanism, like a catch, to get us unstuck when we are maybe stuck in that role a little bit too much, you know. And we need to be talking about not victimization, but surviving, you know, how do we move past that? So I like using survivor and I like using thriver. And that comes from trauma literature, you know, that's like these stages of movement through trauma recovery. That's Judith Herman, Trauma and Recovery. That would be that model. Rescuer, I don't know. I don't have a problem with the word, but I might call it over advocating, or sometimes how our help can kind of spin out of control. You know, we just, helping is great, but sometimes we can lose a sense of ourselves while we're helping, and accidentally, you know, get into nice, where we're accidentally maybe hurting other people through our intent to help. Persecutor, believe me, experience. I don't use that word. I use bad guy. You like being a bad guy, you know, like it's just conversation, right? It's kind conversation. I get it. You're the kind of person who feels like, you know, other people are kind of no good, and your belief about yourself is that to survive, you gotta wear the black hat. You know, like you're the black hat guy. You root for Vader. Like whatever you can use through that person's experience in the world can help them identify with the role to move away from any kind of pejorative languaging, right? So if you have examples of, you know, the hero Superman, right? and I will tell the story about Monty Python. And if I'm killing people on time, let me know. But there's a Monty Python skit, if you've ever seen it, where everybody who lives on this one world, they're all supermen, and they all ride bikes wherever they go. So the superhero on this planet is bicycle repairman. Like, it's a funny way of thinking about, we can't all be Superman, and maybe Superman isn't even the model you want. Maybe sometimes people just want a bicycle repairman because you can't fix everything, right?
One last question, if you have time. It's in relation to manipulation. It's as far as manipulation goes, even if the person says that they didn't intend you to feel that way, what other follow-up questions can you ask if they know they might be lying? And then, are there any books you recommend on nonverbal communication?
Okay. I'm not 100% sure I'm following the question all the way through, but I'll take a stab. So where I get my, call it, clinical positioning around manipulation comes largely from Linehan and her definition, and her working with borderline personality pathology, and why she clearly says if there's any group of people incapable of manipulation, it is in fact the borderline personality. They're too emotionally labile, too impulsive. They're too in the moment. They can't really do that long-term thinking to be pre-planful about getting people to do things. So she's really clear about that. She takes a hard line. I don't take such a hard line, mostly because of this. These are not discrete, siloed entities. Like you have borderline features and nothing else. Like, that's not a thing, so much. You could have a little bit of this and a little bit of that. So the unspecified personality disorder, or just the features, right? So if you're experiencing someone talking about manipulation, all Linehan's really saying is that's not coming from the borderline pathology. It could be coming from narcissism, could be coming from histrionic, antisocial, could be coming from any number of other phenomena, or, by the way, just non-pathological. It's just something. So I don't know if that fully answers that piece of the question. And what was part two?
Part two was if you had any recommendations on books for nonverbal communication.
Okay, so I like the McKay Fanning book on messages. This is like early in learning about couples therapy, or even when you do group therapy. Obviously, as a clinician working with 2, 3, 4, and yes, one person, getting to read nonverbals. The McKay Fanning book, Messages, does pretty good at just kind of giving you a primer for that. There's all kinds of YouTube stuff out there. One caveat, though, all the lie detectors and, the former FBI agents that can catch you by watching you twinkle this and do this and that, I don't get involved in that. I don't mind being lied to. Frankly, I don't care. That has nothing to do to me with clinical change. And I could tell a story about someone who lied for 6 months in therapy and benefited, even though the clinician felt like a fool because they were doing grief and loss work for someone who never actually died. Like, at the end of the day, it's grist for the mill. Therapy doesn't have to be so concretely about facts. I talk a lot of time about, how truth is transient. Today's facts are tomorrow's fictions. Therapists aren't detectives. Like, yes, we want to understand people's narratives, but not to do gotcha work. It isn't gotcha stuff. You can create an awareness of discrepancy with people, and this is very effective with people with narcissistic tendencies. You simply kind of call out help me understand, because you said A here, and then now you're saying B. I'm just not getting the connection. It's not a gotcha thing. It's a curiosity thing, which with this population, the 10 groups, it's largely planting seeds. The person with a narcissistic pattern of interaction isn't likely in that moment to go, you got me. All right, I'm done being narcissistic. Thanks, we're done. That's not going to happen, the kind of spontaneous change. But planting seeds is the model. We just often don't see people long enough in therapy to watch them grow. But my full belief is they do. People mature, they add experience on top of messaging they heard from you and from other people. And that creates experiential being in the world. And they might decide, I'm not on Jeopardy. Why do I need to be right all the time? It's really just causing me more problems than, than it's helping. So I hope that answered the questions.
Yeah, it looks like all the questions I see in the chat.
Excellent.
A lot of good feedback that it was an excellent presentation, very useful, helpful information.
Thank you, Chris. That was wonderful. And thank you, Kathleen, for the chat and the responses to the knock-knock jokes. Good job. I want to thank you all for participating in today's session. I hope you enjoyed it as much as I have. I pasted the link to the evaluation in the chat box and ask you to take a moment and complete that for us. If you want to hear more from Chris, please tell us what else you'd like to know about personality disorders or anything else he mentioned, and put that in the evaluation so we can figure out what potentially to do for next time. So Chris, if I'm making the decision, you're on the hook for a next time, please. So today's presentation will be posted on our webpage at erie.gov mental health after this session, probably be up by tomorrow. We will not be having a session in December. We'll resume in January. I'd encourage you all to mark your calendars for the fourth Tuesday of the month from noon to 1. We will be sending out notices for this future sessions, and you can also keep an eye on our webpage for those announcements. All of the past presentations are also on our website, so if you know anyone who missed this one, you can send them there. And the other trainings we've had this year have also been wonderful. If you're interested in being a presenter, I could say this a million times, let me know. You can email me at amy.rockwood@erie.gov. And if you have a topic you'd like to know more about, send that to me as well. Thank you again, Chris, for such a wonderful presentation, and to all of you for being part of our collaborative. On behalf of the Erie County Department of Mental Health, we wish you all a safe and happy holiday season, and have a great day. This was awesome. Thank you.
Thank you.
Thank you.
Anything else you need from me?
How about your availability for 2022 on all of the fourth Tuesdays?
Tuesday afternoons are really never a problem. So yeah, I mean, if people have an interest in a topic, I'm more than happy to